We are working on a number of things internally within our organization, focusing on making sure that we're adhering to the CDC guidelines that are established for the healthcare industry. Those guidelines are very detailed, and they are very explicit about how we care for patients, how we screen patients, and how we make sure that we're taking care of them as well as our team. We're doing an outstanding job in that. And as you can imagine, those guidelines change regularly, hourly, some would say. So staying on top of what those guidelines are, making sure that our staff is trained on those guidelines, have all of the appropriate equipment and training and documentation that they need to be effective at what they do, and then making sure that we've got our partners available, both within the state of Maryland at the Department of Health and Mental Hygiene and Dr. Sharfstein and the health officers, as well as at the local level with our EMS providers, transporting patients back and forth from our facilities, working very, very closely with our healthcare providers in our community and at the state level to ensure that we're following those guidelines. So we are doing an extremely good job of understanding our role and responsibility, preparing for that Ebola patient that could enter our facility from any location, from a doctor's office to an emergency room, and really working hard to make sure that we understand our role and responsibility, are trained adequately, have the appropriate equipment, follow the appropriate guidelines, and ultimately get that patient to the level of care that they need to if in fact they do have Ebola. So more to come on that, but as things change, we're staying on top of it, and our team is doing an outstanding job. There are really two dynamic changes that have occurred. One is within the federal government and the Affordable Care Act, and that is really, from my perspective, just a way of ensuring that patients have coverage for insurance and access to care. And as a community hospital, we are required to, and it's our mission to provide care for our community regardless of their ability to pay. So as a nonprofit, we've been always providing care in our community, so that hasn't changed. Insuring patients, though, and allowing them to get access to providers, primary care, specialty care, is something that's new, though, with the Affordable Care Act. And a lot of times they weren't getting that access to care. So with the federal law, it's allowed them to get some of that access outside of the hospital system, which in turn helps keep them out of the hospital system. Because if they're seeing their primary care and specialty care on a regular basis or as needed, they're not using the emergency department or the hospitals for their care. The second piece that I'll share, at the federal level, there's a lot of changes, but within the Maryland system, we've had a unique system here that really regulates how health care is provided and paid for that we've been adhering to over the last 4 decades. So we've been under a completely different system at a state level in Maryland than the rest of the country. And that's a regulated environment. That's where the state regulates our rates, the state regulates the amount of revenue that we receive as a healthcare system. And that's what's gone through dramatic changes as of January 1st of this year. Those changes have really caused us to revisit who we are as an industry in the state of Maryland. Specifically, when you look at things like our previous incentives used to be about growing volume, add business, try to do as much of your region and beyond as possible. That's changed from growing volume to growing value. And that's a critical change because we were all in competition for that patient and those services. Now it's more about value. We've also expanded from what we've used to call sick care, so taking care of people when they're sick, emergency room, hospitals, operating rooms, to really well care. Focusing on the acute care and sick care as well, but expanding that into the well care environment. And by well care, I mean keeping patients out of the hospital, making sure they've got primary care access, making sure they've got access to services locally within their local jurisdiction. That's a dramatic sea change from just focusing on hospitalizations, focusing on inpatients and emergency room visits. And that's really caused our entire industry in the state of Maryland to rethink how we provide care. That in the new waiver with the state of Maryland that was just signed on January 1st, the vision is clear. The vision is that we need to care for the wellness of our community and keep our community healthy and keep them out of the hospitals and out of the emergency rooms. Before that new focus, counties like Caroline County were using the emergency department as their primary care facility. And when you're in an environment where you're only going to get so much revenue for the services that you provide, we're capped on that revenue, you really have to think differently about where you're going to provide services and what those services are and in order to keep those patients out of those high dollar, high cost areas like the emergency department and the hospital. So in Caroline County specifically, by setting up an urgent care center in Denton, we're now available to the community in their community, and no appointment necessary, extended hours into the evening during the week, and really allowing patients to walk in and use that facility as opposed to calling 911 and coming to the hospital ER.
Would you deploy that in another part of the region?
And that's part of our assessment, is to really look at the rest of our region, understand where that makes sense, and where we can deploy similar types of setups in other locations. Part of our strategy is also to look at our hospital facilities, understanding where they are, what they serve, what level of services are provided in each hospital, and determine what's appropriate for today and for the future. As we're impacted by the state and regulations and changes, we know that one of our goals as a state is to reduce the cost of healthcare. We also know that the most expensive cost of healthcare is in the hospital four walls. So we've got to figure out a way to keep hospitals viable in our region as a necessity of the whole continuum of care, but also understand how else we spend our dollar wisely to provide primary care, provide specialty care, provide some of the support services that our patients need to keep them out of the hospital and keep them out. There are a lot of enabling steps to get from where we are today to building a regional medical center in Talbot County. But one of the things we wanted to demonstrate very clearly to the town and to the county is our commitment and our intent to move in that direction, to build the regional medical center. So it's not so much are we, but when and what size and what services are going to be offered in the facility. And not even where. Where has been clearly determined as well by the airport near the community center. So we felt like the timing was appropriate, even though all of those enabling steps are not in place yet and we're not complete with those things. We felt like the timing was appropriate to at least complete the DRRA, get that signed, and show our commitment from that regard, and then also purchase the land as another way of showing our commitment and our intent to build on that site. I'd have to answer that by saying I think the magic wand I'd wave is to increase the number of physician providers that we've got in our region. As I mentioned, primary care is critical to the new vision of the nation for healthcare, the new vision of the state of Maryland for healthcare, and it's tough. It's tough. There aren't enough primary care providers in the country, in the state of Maryland, and when you look at rural Maryland, there's even less that we're able to attract in our region. So having enough primary care physicians that are out in our communities, I think is part of the long-term solution to our success. And unfortunately, the human resources of physicians and nurse practitioners and others that support primary care are limited. And it's very, very tough to attract to this region.
Is that a salary issue? Is it a quality of life issue?
It's a little of both. It's a little of both. Salaries are tough. I mean, it's a very competitive market, so the number of providers are very, very small. The demand is very, very high. And when you're competing for primary care providers, physicians in general, they'd like to have access to city life in large parts and the things that go with that. They'd also like to ensure that there are good schools, good educational systems in the region, and a good environment for their kids to grow up in. So all of that together really factors into the physician's decision on where to go. And we believe we offer a great environment for our primary care physicians. We offer competitive salaries in this region, but it is still very difficult to recruit and retain providers here in this community. So that's the magic wand I'd wave, is figuring out a way that we can shore up that huge need in our region, and because that has such a dramatic effect on everything else. If you have primary care providers, our patients have access to them, our community has access to them. They're not coming to the emergency room as frequently. They're not being admitted as frequently. Their chronic conditions are being managed much better, and less effort and energy is spent on those things that could be managed by our providers outside of the hospital. And then those that need our hospitalization, need our emergency rooms, then get the attention and access that's there for them. I really tried to focus my energies and efforts on creating the best healthcare system we can here in Maryland and at Shore Regional Health. I lose sleep a little bit over whether or not we've got enough resources to do what we need to do to meet the demand. I lose sleep a little bit over whether or not our community understands what we're trying to accomplish and embraces that, because that's critical to our success. I lose a little sleep over learning when patients don't use our services and trying to understand why, and trying to make sure that if they didn't know we offered it, make sure that they're aware of it. If it's not up to par where it needs to be, then get it up to par where it should be. Because ultimately, again, our vision is to be the patient, the region's leader in patient-centered care. We want our patients to use our facilities, use Shore Regional Health for their care, and I probably won't stop losing sleep until we accomplish that vision. I think I'd just like to thank the community for all of the things that we do collaboratively and together. You know, Shore Regional Health is a very important part of our community, and we rely very, very heavily on the partnerships that we formed within our communities. And it's those partnerships, it's partnerships with our elected officials, it's some of the innovative things that we're trying to do that get us above and beyond what the traditional hospitals and healthcare systems are doing that I think really strengthen who we are as an organization. The relationship that we have with the University of Maryland Medical System and the expertise that they provide beyond what we can provide here in our community is just phenomenal. So I'd like our community to know that we are strong from every aspect of the healthcare industry. I'd also like to thank our physician partners and our clinicians and our expert techs and technologists and technicians and everybody that's part of our team that provides great care. You know, it's in and of itself, it's a daunting task to provide health care in a community like ours. But our team comes to work every single day. They're dedicated. They're devoted to what they do. Our patients get the best high-quality care that we can provide in our community, and they're highly satisfied with that care. And our goal is just to continue that and then continue to look at how we can expand our services in our communities and make sure that Shore Regional Health is their first destination for their care.